Hi, Yanela Tubon. My topic is a randomized trial of hyperglycemic control in pediatric intensive care. Definition: the hyperglycemic is a common manifestation in patients hospitalized in and out of the intensive care unit. Hyperglycemic is associated with increasing morbidity, mortality, and hospital stay.
Or not too low. The goal is to keep your blood glucose level in a target range, not too high or not too low.
69, so I need to give you a juice box.
When blood glucose gets too high, that's called hyperglycemia. We talked earlier about problems that can result from hyperglycemia: damage to your eyes, kidneys, nerves, and blood vessels. If blood glucose gets too low, it's called hypoglycemia, and that can create problems too.
Prospective studies have shown that many health professionals do not have a well-formulated and objective to make hyperglycemic in the hospital approach.
Researchers at Joslin Diabetes Center have found a new use for an old medication, the treatment of type 2 diabetes.
We have found that a medication that has been used for many years to treat arthritis is actually beneficial to improve blood sugars in patients with diabetes.
Doctors Allison Goldfein and Stephen Schulson conducted a clinical trial of the drug salicylate, a cousin of the common drug aspirin.
It is a derivative of salicylate. Salicylate is one of the oldest drugs known to man. It's been apparently in clinical practice at least since the time of the Egyptians. We found evidence of its use.
So in this specific trial, we identified patients who had type 2 diabetes that was inadequately controlled on their current medications, and they were randomized to take either salicylate or placebo and be followed for a period of a year.
They saw the people.
Pros: the insulin administration may prevent some of the adverse effects associated with hyperglycemia. Insulin can induce vasodilation, inhibit lipolysis, decrease free fatty acids, inhibit platelet aggregation, and lower the inflammatory response.
The face of type 2 diabetes is changing. Once known as an adult onset disease, type 2 diabetes in children is on the increase. The symptoms in children are the same as in adults: increased thirst and urination, weight loss despite increased hunger, fatigue, blurred vision, darkened skin, wounds that are slow to heal. These young lives are cut short. They are left to deal with problems that are usually experienced by older people. As a parent, it is difficult to see your child suffer, and even more difficult to help them come to terms with an older person's illness. You can change their lives with just a few simple yet disciplined steps. These steps are all found here: www.cureyourtype2diabetes.
Accounts: the hyperglycemic leads to complications such as heart failure, coronary artery disease, hypertension, and kidney failure.
So, I'm Dr. Tyre. I am the pediatric liaison for Sacramento, and I am working with Deb to kind of enhance our pediatric training in the ED. And so every month what we're going to be doing is these pediatric mock codes based on different topics. And this month's topic is pediatric diabetic fetal acidosis. like to start off with is still a scenario. But a 70-year-old male that presents to the emergency department with one-day history of vomiting and just not feeling well. Current vitals are up there. Normal temperature, a little bit tachycardic, a little bit hypnic, a little bit hypotensive with a blood pressure of 90/65. When you look at him, we can get some past medical history. No medical problems, doesn't take any medications. So
Disease. Studies indicate that it is associated with an increased risk of complications: coronary heart disease, heart failure, hypertension, and renal and kidney failure, longer hospital stay and higher rates of surgery utilization and morbidity.
The face of type 2 diabetes is changing. Once known as an adult onset disease, type 2 diabetes in children is on the increase. The symptoms in children are the same as in adults: increased thirst and urination, weight loss despite increased hunger, fatigue, blurred vision, darkened skin, wounds that are slow to heal. These young lives are cut short. They are left to deal with problems that are usually experienced by older people. As a parent, it is difficult to see your child suffer, and even more difficult to help them come to terms with an older person's illness. You can change their lives with just a few simple yet disciplined steps.
Thank you.